Good day. So this is a discussion related to radiographic pathology. We have the hepatobiliary system, ng mga pathology conditions of the hepatobiliary system. So first one, we have the fatty liver disease. So this disease may be demonstrated with the use of sonographic modality or the ultrasound modality. So the patient may undergo ultrasound examination of the upper abdominal niya nga area or the whole abdomen niya nga area. Okay, so the main cause or the common cause of fatty liver disease is alcohol abuse. Okay, so magsigig inom. Okay, and because of alcohol abuse, since about when we intake alcoholic substances, the toxins that are in the alcoholic substance will be detoxified by the liver. Okay, so because most of the liquids, most of the blood not to passes through the liver, so if ever na mga toxins, it will pass through the liver, and because of that, sometimes because of the abuse, magsigilag inom every day na ay alcoholic substance, and not just small amounts of alcoholic substance but large amounts of alcoholic substances that may later on cause damages within the liver parenchyma. Okay, so alcohol abuse may also lead to fatty infiltrates within the liver, since the parenchyma is already damaged, so the fatty infiltrates will just stay there within the liver, dato nga mga tissues. Okay, so obese individuals with type 2 diabetes mellitus can also lead to fatty liver diseases, especially if the patient has a lot of fatty materials again na intake niya, and diba, the fatty materials that we intake, they are stored within our liver. Okay, so if they are not stored within our subcutaneous tissues, then they are stored within the liver. The purpose for that is the fatty materials within our liver, this will be used later on to be converted as a sugar na when we need energy if wala na tayo food kinakaon. So the fatty materials will be converted into a sugar that can be used by the body. Okay, so some patients, also persons, may have metabolic syndromes. Maybe their body cannot process the fatty materials that they are intaking. Okay, so that's why mag-store dito sa ilahang liver, and then those fatty materials will not be converted by their liver. Now, even if small amounts of fatty materials lang ilang gina-intake, but then the fatty materials are not digested. Okay, so also if ever the patient has hyperlipidemia, or all of these diseases are at increased risk of developing non-alcoholic fatty liver disease. So again, this is the most common cause niya, the alcohol abuse. Okay, so steatosis, excess of fatty acids within the liver, which lead to, or steatosis, this is the excess of fatty acids within the liver, which leads to fatty infiltration within the liver. So daghan kay kag fat sa imuhang liver ani. Okay, so alcohol cannot be stored in the human body, and therefore the liver must convert it through oxidation to alcohol dehydrogenase, acetaldehyde, and acetate, all of which reduces cellular function, or the cellular function within our liver. So that means the cellular function of our liver within the liver parenchyma is affected. So they may result to hypo nga mga conditions na mag-reduce ang function sa atong cellular bodies within the liver, or it could stop the function of the liver nga mga functional units. Okay, so chronic alcohol abuse often leads to fatty liver followed by hepatitis, na because nadaot naman iyang liver, so later on na it will cause inflammation, it will cause cirrhosis, the hardening of the liver tissues, and then hepatocellular carcinoma, na formation of mutated nga mga cells. Okay, so because of alcoholic nga abuse, and because of this na siya infection within the liver, so later on na it may cause carcinoma, formation of malignancies. Okay, so next, no, related gihapon diri sa fatty liver disease. So, if ever na ay fatty liver disease ang patient, one of the possible pod sad nga following diseases niya is liver cirrhosis. Basically, the hardening of the liver tissue or liver parenchyma. Okay, so chronic liver condition, chronic that means long term. Okay, chronic liver condition in which the liver parenchyma and its architecture are destroyed. So again, main cause ani is alcohol abuse. Fibrous tissue is laid down and regenerative nodules are being formed. Okay, so basically nasamad ang imuhang liver parenchyma, nadaot imong liver parenchyma, and because of that, fibrous tissue is being formed. Numra siyang mga scar nga tissue. That's why your tissue is hardened. That's why your liver will also harden, and if ever the liver parenchyma hardens or the tissues niya are being hardened, then of course that will reduce the function or may stop the function of the cellular body. Okay, so naay mga tissue, naay mga cells, but then they are not functional. Yung mga fibrous sila nga tissues. Okay, so it affects the entire liver and is considered as an end-stage condition resulting from liver damage caused by chronic alcohol abuse. Okay, so other than chronic alcohol abuse, drugs, autoimmune disorders, metabolic and genetic diseases, chronic hepatitis, cardiac problems, and chronic biliary tract obstruction may also cause cirrhosis. Okay, so of course, dili lang si fatty liver disease, but most commonly, fatty liver disease mo-follow gid na si liver cirrhosis. Okay, so if the patient is abusing drugs also, then of course that will lead to damages in the liver, and then later on, damage that will lead to scarring of the tissues within the liver, and then lead to fibrous nga tissue formation, mga scar formation within the liver parenchyma, and then of course that will lead to the hardening of the liver. Okay, so if ever naapod siya cirrhosis, one of the signs ana is that the patient will develop ascites. Siya, accumulation of fluid within the peritoneal cavity. Okay, so it's because if ever na ay nagka-cirrhosis na si patient, again, no, mag-harden ang iyahang liver tissues, and because of that, wala na mga hormones yung ginasecrete si liver, and one of that hormones is one of the hormones that the liver is producing helps in the reduction of the fluid within the peritoneal cavity. So if ever that hormone is absent, then of course fluid will accumulate. Now, a lot of fluid will accumulate within the peritoneal cavity. Muna nang magka-ascites si patient. Okay, so that's why if ever makikita mo mga alcohol ng mga abusers, some of them have very large tummy. Dagko sila mga tiyan. That's because na sila mga fluid within their peritoneal cavity. Okay, so peritoneal cavity also known as the abdominal cavity nato. Okay, so there siya gatapok. So mga dagko kaya na sila mga tiyan. There's a lot of fluid within their peritoneal cavity. Okay, so these are the appearance of the fatty liver and cirrhotic liver in sonographic imaging, ultrasound imaging. So again, they can be demonstrated using ultrasound imaging. Siya ang the best modality to demonstrate these types of diseases. If ever mag-x-ray ta of patient with fatty liver or cirrhotic liver, then they will not be demonstrated. The soft tissue structures will not be demonstrated. CT scan can also demonstrate fatty and cirrhotic liver, but then of course when we try to consider exposing the patient to ionizing and non-ionizing radiation, dito lang tayo mag-expose yung patient sa non-ionizing type of radiation, that is through ultrasound examination. Okay, so this is the appearance of a normal liver in ultrasound. This is your liver parenchyma. And then the images being produced by ultrasound is similar to CT scan and also MRI. They are presented as slices. Na mga slice na siya, individual slices of the body. Okay, so the ultrasound lang, it produces slices but in real-time imaging, while the CT scan and MRI, static sila nga mga imaging. Okay, so we have the liver parenchyma, in which the whole of the liver parenchyma is um, ay, wait lang, it's a eraser. Siya. The whole of the liver parenchyma is almost echogenic. They have the same echogenicity. That means same ang ilahang echo, no? Same ang ilahang colors sa ilahang surrounding. Na siya. Okay? So if ever there will be problems with the liver, then sometimes they will appear as either brighter or much darker compared to their surroundings. So the most common nga organ that we can relate to, we can compare the liver to, is this one. This is the kidney. Okay, so in normal conditions, if the patient has normal liver, normal niya kidney, then supposedly your liver and your kidney should be of the same color, same echogenicity. Okay, so if napay liver diri nga na-demonstrate unta, it should be the same color na siya. Same na silang color dapat ang imuhang liver and then also ang imuhang kidney. We call them as the echo textures, mga echoes, because it is using sound waves. And sound waves in the body are reflected, so that's why they are termed as echoes. Mga echogenic. They have the same echogenicity. So in this ultrasound image, lahi na sila color, lahi nag echogenicity ang imong liver compared to the kidney. So the liver appears brighter compared to the kidney. And then also in the cirrhotic liver, wala na demonstrate si kidney dire, but then as you try to compare this one, the echogenicity of the liver compared to the normal liver siya. So most of the lobules have been absent already. Siya kanang mga bangag-bangag diha. Siya. And then instead of having a uniform somewhat darker gray na color, na medyo na nag-increase ang iyahang pagka-grayness na towards the light gray, na padulungan na siya sa white. No, also the same with this one. Okay, nag-change ang ilahang echogenicity, nag-change ang ilahang color. Okay, so next, related also to having cirrhosis or fatty liver disease, we have jaundice. Jaundice is a yellowish discoloration of the skin. Siya, the skin and the whites of the eyes. So this is the most common yang indication na mag-yellow ang imuhang whites sa imong eyes instead of being white, na siya yellow. And then your skin na mag-yellowish iyang discoloration. Okay, so it is not a disease, but rather it is a sign of the disease. So most commonly, sign that the patient has liver cirrhosis. Okay, so the main common cause, the main cause why the patient will experience jaundice or the yellowish discoloration of the skin and then the eyes is because of the accumulation of excess bile pigments. Okay, so within the body tissues, in which because of this excess nga bile pigments, it stains the skins and the eyes of the patient. So medyo mag-yellowish o mag-yellowish ang discoloration. So these bile pigments, these are result of the RBC breakdown, or they are the colors sa atong RBC. If ever mga matay atong RBC, they will be filtered by the liver, and then these bile pigments is supposedly ipadulong na ni liver or i-deliver na ni liver padulong sa atong intestinal tract to be excreted along with our feces. So if ever na ay problem, like for example, nagka-liver cirrhosis si patient, then of course, the liver will not process the bile pigments. It will just stay within our blood system, so that's why they can travel throughout the body. Okay, so there are three main categories of jaundice. These are, number one, we have prehepatic jaundice. Second is the hepatic jaundice. And the third one is extrahepatic jaundice. Okay, so prehepatic jaundice is due to excess production of bilirubin. Daghan kay na-produce nga bilirubin ang imuhang body. Daghan kay RBC ang gakamatay sa imuhang body. Maybe there's a problem with your metabolic processes, maybe there's a problem with your RBCs. Second is hepatic jaundice. This is due to congenital liver disease. Like for example, na kay liver cirrhosis, na kay fatty liver disease, or maybe na kay hepatitis. Yes, so the problem itself is with the liver. No, na problem ang imuhang liver muna nagka-jaundice ka. And then third is extrahepatic jaundice. Wala problem imong liver, but then the passageway, the passageway or the drainage of the bile from your liver towards the gallbladder or towards the small intestine is naay blockage, no? Due to blockage of bile drainage by gallstone or cancer of the bowel or the pancreas. So if ever diba, this is your liver, try to draw a liver siya, and then as liquids will flow out of the liver, itong mga excess ng mga fluids, na some of them will be deposited diri sa imong gallbladder. And then some of those fluids, if ever kailangan na siya sa atong lawas, especially if naay mga fatty materials, then your gallbladder will contract, and then that fluid will flow out, and then that will be delivered towards your small intestine. Okay, so if ever na blockage rin, no, because of stone, gallstone siya gallstone dira, o maybe naadari dapit nakabutang ang stone, na blockage dira. So of course, the fluid will not be able to flow out, no, padulong there is a small intestine. So that means most of these liquids will just will be absorbed back by the liver, and then will be transferred towards the blood system, towards the circulatory system, and then will circulate the body. So that's why the skin will have a discoloration then later on, katong yellowish nga discoloration. Okay, and then of course, if ever na po cancer, no, kung na cancer si patient, like for example dere na siya problem sa iyahang pancreas. So if ever the pancreas, basilingan naman na sila dara. So if ever na problem si pancreas, na cancer si pancreas, so pwede na siya mudako, and then pwede niya ma-push ang imuhang passageway, so which will cause constriction, no, na dili makapass through atong bile. Okay, so next we have hepatitis, no, itis related to inflammation, infection. Okay, so this is the most prevalent inflammatory disease of the liver. Then the most common cause are viral infection and reactions to drugs or other toxins. Okay, so we have viral types of hepatitis. Now we have hepatitis A, we have Hepa B, we have C, and then the Hepa E na mga viruses. Okay, sorry, natabunan sa camera. Okay, so first one we have the Hepa A, second is the Hepa B, third is the Hepa C. We also have Hepa D, Hepa E, and then Hepa G na mga viruses. Hepa A is being transmitted in the digestive tract from oral or fecal contact. So if ever naatay mga food, naatay water nga gina-ingest, so we can be in contact with these viruses if ever those materials, those food materials, water materials is contaminated by fecal substances. Then Hepa B nga virus contacted by exposure to contamination of blood or blood products or through sexual contact. Then for hepatitis C virus, common cause of chronic hepatitis, we also have cirrhosis and then hepatocellular carcinoma. So if ever na kay chronic hepatitis, the most common cause niya na is Hepa C na virus. And if ever na po kay liver cirrhosis, you may also come in contact with a Hepa C virus if ever wala kay fatty liver disease. Okay, so it may be contracted by blood transfusion or sexual contact. Then for Hepa D virus is caused by RNA virus and occurs concurrently with acute chronic HBV. So this one sa Hepa B na virus. If ever na kay Hepa B nga virus, dali ra pod ka matakdan og Hepa D na viruses. Okay, and then next we have Hepa E. Virus acquired by ingestion of food or water that has been contaminated with fecal material, na almost the same with Hepa A. Most commonly responsible for outbreaks of waterborne epidemic acute hepatitis in developing countries. Then last, we have the Hepag. It is the recently isolated hepatitis virus, which may also be transmitted via blood products and may cause chronic hepatitis. Okay, so for the medical students, we have the vaccination against hepatitis B na virus. It's because if ever na mo sa clinical setting, mag-internship na mo, so you may come in contact with the blood or blood products or bodily fluids of the patient. So next we have cholelithiasis. Lithiasis would refer to the condition of having stones na nakay stones sa imuhang biliary tree. Okay, so can be located anywhere within the biliary tree. So baka natay liver na, then we have the left and right nato nga hepatic ducts, and then you also have the cystic duct going towards the gallbladder. Then you have the common bile duct, pagawas na siya dito sa atong small intestine siya towards the duodenum. Okay, so if ever na stones na naa siya gallstones, na siya cholelithiasis, na stone within the biliary tree, so the stone can be located here, can be located here, can be located here na siya. Okay, so these stones may cause problems because they can block the flow of fluid, they can block the flow of bile towards the intestinal tract. Okay, so diba dapat ang bile is mo flow from the liver towards could be towards the gallbladder, no, for storage and concentration, and then later on dayon will flow or will be delivered towards the duodenum if necessary, if needed, especially if we are ingesting fatty materials. Okay, so if ever na ay cholelithiasis si patient na nasa stone sa iyang biliary tree, the symptoms can include bloating, nausea, and pain in the right upper quadrant. So our abdominal area, they are divided into quadrants. Now we can divide them into quadrants. So you have the right upper quadrant, the right lower quadrant. You also have the left side, the left upper quadrant, and then the left lower quadrant. So our liver is located on this side, the right upper quadrant. So about 80% of all stones are composed of a mixture of cholesterol, bile pigment, that is through bilirubin, and then calcium salts. Okay, so that's why if ever mag-x-ray tag patient, some of those stones na sa ato ang biliary tree, they can be demonstrated using x-rays because some of these stones are made up of calcium salts, and if ever they are made up of calcium salts, they will appear as white on the radiograph. Now, they will appear as radiopaque on the radiograph. Okay, but then the most common examination or the modality that can be used to demonstrate or to diagnose cholelithiasis or stones within the biliary tree is ultrasound. Okay, so ultrasound gihapon ta nga imaging. Okay, so can be demonstrated gihapon using CT scan, but then the most common is ultrasound examination. Okay, so again, with the use of non-ionizing type of radiation. Okay, so the occurrence is almost common in people with diabetes, especially daghan kay sila mga fat sa ilang lawas na dili lang ma-deposit ito sa liver but also ma-deposit gihapon dira sila diri sa ato ang gallbladder. The most of the bile contents is cholesterol, so that's why na formation of cholesterol ng mga stones. And then those who are obese, again, almost similar gihapon daghan kay sila mga fat sa ilang lawas. And then older adults, especially wala na kay sila physical nga activity, so that's why the fats are being accumulated within their body. And individuals who eat primarily a diet high in saturated fat, sugar, sodium, and low in fiber and nutrient density. Okay, so symptoms associated with cholelithiasis may be vague, including to na mention ganina, bloating, nausea, and pain in the right upper quadrant. So may siya pinaka-common gano'n na ay pain in the right upper quadrant if ever na stone si patient. Okay, so just an example image. This is an ultrasound image of the gallbladder. This is the gallbladder of the patient. Siya being filled with bile. Okay, so ang bile in ultrasound, or the fluid in ultrasound, appears as black, which is opposite sa x-ray. Okay, if ever mag-x-ray tag patient, fluid will appear white, but in ultrasound the fluid appears dark. And then this kani sila mga white nga mga portions within the gallbladder. These are actually the stones, no? This is the normal nga wall sa atong gallbladder na siya. Normal siya nga wall, no? Almost equal ang ilang density, equal ang ilang echogenicity, equal ang ilang echoes, equal ang ilang color. But then in this area na ay mga formation of somewhat solid nga material. Okay, so that is an indication that the patient has naa siya'y stones, naa siya'y cholelithiasis. Now, this is cholecystolithiasis because the stones are located within the gallbladder. So, cholecystolithiasis. Okay, so next, kuan mo din cholecystitis. Okay, so this is related to cholecysto, that is the gallbladder, and then itis, that is inflammation or infection. Okay, so cholecystitis, that is the acute inflammation of the gallbladder of the patient. Okay, so it is characterized clinically by a sudden onset of pain, fever, nausea, and vomiting. So in this procedure, same lang gihapon, ultrasound lang gihapon nga imaging. This is the gallbladder. Then the walls of the gallbladder are being measured. So if ever magthicken na sila, so that is a clear indication that the patient has an inflamed nga gallbladder. Nagthicken ang wall sa imuhang gallbladder. Then the cause is kana siya na naay stone si patient na nagyapon siya cholecystolithiasis. Na siya. Okay, so if these stones na napaman sila sa imuhang gallbladder, so later on na when the gallbladder contracts, these stones may flow along with the bile, mag-flow out na sila sa imuhang gallbladder, and then they will go out to the cystic duct, and then maybe if ever dagko sila, then it can block off the cystic duct, maybe the common bile duct of the patient. Okay, so next we have the carcinoma of the gallbladder. Okay, so this is carcinoma of the gallbladder. Sorry, natabunan. Okay, so more common or the carcinoma of the gallbladder, basically the cancer or malignant disease of the gallbladder, are more common in women and older adults with gallstones present in about 75% of all cases. So that means if ever na ay gallstone si patient, so dako po sa kayang possibility ni patient nga maka-develop siya o carcinoma of the gallbladder. So malignant disease. This is a malignant disease of the gallbladder. Okay, so pag when we talk about carcinoma, again, sa atong mga previous discussions, carcinoma, these are the cancers. These are the types of tumors that can invade other organs. Okay, so the symptoms are non-specific but can include right upper quadrant pain, jaundice, and weight loss. Okay, so these are all related to being adult na, no? Okay, so if ever paspas kayong weight loss ni patient, tapos na siya right upper quadrant pain, tapos na siya history of having stones within the biliary tree o sa iyahang gallbladder, so taas ang possibility ana nga nagka-develop si patient o carcinoma sa iyahang gallbladder. Okay, so check-up is always necessary. Yes, another risk factor associated with development of gallbladder carcinoma is the appearance of porcelain gallbladder, which results from chronic cholecystitis. Na maski infect ang imuhang gallbladder, na this is cholecystitis. Na katong infection or inflammation of your gallbladder, and then if ever magsige ka-inflame, magsige ka-infect imuhang gallbladder, Then of course, no, later on, some of the cellular bodies may mutate, and then because of that mutation or that mutated nga mga cellular bodies may cause rin the malignancies. Okay, so if ever na kay cholecystitis, sometimes one of the causes po sa ana is having gallstones. No, na kay stones within your gallbladder, and because of that, gaka-damage ang imuhang walls sa imuhang gallbladder, so that's why they will be inflamed, or the whole of the gallbladder will be inflamed. No, magka-infect dayon siya, and then later on magmutate ang cells which will cause the formation of malignancies. So kung mag-expose na normally when we expose patients, na pag wala siya condition sa liver, wala siya condition sa iyang gallbladder, sa biliary tree, we do not see the gallbladder or the liver in plain radiography. That means without contrast. So if ever na ay problem sa iyang gallbladder, like for example in this condition ni patient na naa siya carcinoma sa iyang gallbladder, so possibility na is pwede siya makita sa x-ray. Okay, so nag-calcify na ang wall sa iyang gallbladder because of chronic nga cholecystitis, and then later on din na nag-calcifications dayon dra, formation of mga calcified substances along the walls of the gallbladder. Okay, so that is an indication that the patient has carcinoma of the gallbladder. Na siya, makita na to na siya. So this is the gallbladder na siya. Okay? So when you try to compare this to a normal gallbladder, of course, mas gamay ang normal gallbladder compared to this one. So, excuse me. So medyo nag-increase na yung size again because of the malignant nga formation. Okay, so if ever mag-ultrasound po we can also demonstrate that. Now, if ever na a problem with the gallbladder, and again, if ever na a problem with the liver, with the gallbladder ni patient, with the biliary tree ni patient, the most common nga modality of choice is ultrasound. Okay, kaya dili mo siya makita sa plain radiograph. So, ang gina-recommend is ultrasound examination. Okay, so makita siya sa CT scan, but then the risk, of course, diba, ma-expose sila ionizing type of radiation. So, dali nata sa mas safer nga area. Okay, so maka-demonstrate maghihapon siya. Okay, so this is also an appearance of the porcelain nga gallbladder in ultrasound. So, very bright. So, if ever na ay calcifications, na ay calcium deposits, na ay mga stones within our gallbladder, within our soft tissue structures of the body, that the ultrasound imaging will demonstrate them as bright. Sa mga bright ilang appearance. Mas similar gihapon sa x-rays, no? Nga the stones will appear as bright. So this is the wall of your gallbladder. Nahayag kay siya. Okay, and then this is part of your liver parenchyma na siya. So, diba, the liver nato or the gallbladder nato is naa ilalom sa tuang liver. So this is part of your liver, and then this is your gallbladder. Okay, so as you try to compare them, diba, lahi na yung appearance. Compare the walls of the gallbladder in this image na ang iyang color, and then compare that to the walls of the gallbladder here. So halos dili na makita ang pikas nga wall niya, diba? Na siya. So ang kanina lang nga wall mo nakita na demonstrate, while the other one is wala na siya na demonstrate. Okay, so next we have sorry for the titles nga natabunan sa camera. We have pancreatitis. This is the inflammation of the pancreatic tissue. Okay, so one of the most complex and clinically challenging disorders of the abdomen, and is classified as acute or chronic infections. So according to clinical, morphologic, and histological criteria. So acute pancreatitis resolves without impairing the histologic makeup of the pancreas, and most often results from biliary tract disease. Na naay problem with the biliary tree, especially sa mga stones, na kung the passageway katong gina-demonstrate ganina, we have the liver na siya, we have the biliary tree dere. Okay, and then naa si pancreas dere. And then si pancreas, diba, in your human anatomy, napo na siya iyang duct, in which ang ilahang passageway padulong dito sa imong small intestine sometimes they are connected, no, ang imong biliary tree and then your pancreatic duct. Bali isa ra ilang exit padulong sa atong duodenum, sa atong small intestine. So if ever na ay stone si patient, gikan sa iyahang gallbladder or maybe from the biliary tree, other parts of the biliary tree. So sometimes they can be lodged here. Siya. So buta na to na stone dara. So if ever na stone dara, then of course that can block off the passage of bile and along with the passage of the pancreatic juices. So muna sometimes magka-problema pod sad si pancreas kay iyang mga toxins and then the juices niya nga supposedly iyatang i-deliver towards the duodenum is nagtapok na sa iyang tissue. Okay? So that may cause infection or inflammation of your pancreas. Okay, so chronic pancreatitis does not impair the histologic makeup of the pancreas, resulting in irreversible changes in the pancreatic function. Okay, so because of the pancreatic juices, sometimes ma-damage ang imong pancreatic tissues. Okay, so causes include excessive and chronic alcohol consumption. No, again, because related sa liver. Nadaot imong liver, and because nadaot imong liver, there could be problems related also to your biliary tree, and because na disruption in the biliary tree, na a disruption of the passageway, so sometimes the pancreas may also be affected. Then obstruction of the hepatopancreatic ampulla, nakatong exit point niya. Kani siya, the hepatopancreatic nga ampulla by a gallstone or tumor, and even the injection of contrast media during ERCP. Okay, so this is endoscopic retrograde cholangiopancreatography. So this is the use of an endoscope during an examination in which the endoscope will be delivered from the mouth of the patient, and then ipaadto ang endoscope towards the duodenum of the patient, and then the tip of the endoscope is diri siya repit ibutang na, and then so since endoscope man siya, so that means na siya camera. Okay, so katong tube, diba, a tube is from the mouth of the patient, kipaagi from the mouth of the patient towards the esophagus, towards the stomach, and then towards the duodenum. So ang tip niya to is naa diri siya, and then from that point onwards, mag-insert na sila catheter so that the catheter will be able to pass through towards the hepatopancreatic nga ampulla. Okay, so because of that injection, because of the insertion of the catheter, so possibility basta nunyag na ay ma-damage ng mga soft tissue structures in this area, which may cause inflammation of this area na kay na ay material that pass through the soft tissue structure. Maybe some of the soft tissue structures kay nagkuan sila na irritate no, because of the material that was introduced. So that may also cause damages or malfunction of the organ or the site or the area in which the material will be introduced. Okay, so during ERCP, mag-introduce man tayo na og contrast material, the iodinated nga contrast material nato. And then the iodinated contrast material is a toxic substance no, for the patient's body, and then if ever dili siya ma-excrete out of the body, so possibility pwede siya maka-cause of problems within our organs. Okay, so symptoms of pancreatitis may vary from mild abdominal pain, nausea, and vomiting to severe pain and shock. Okay, so this is an example if ever na ay problem si patient tapos atong i-try og diagnose si patient. Okay, so we cannot demonstrate the pancreas using plain radiography. We cannot also demonstrate it can be demonstrated using ultrasound, but then it would be very hard for the ultrasound machine to demonstrate the organ because the organ is very deep. Nasa dari dapit nga portion. So the best modality to demonstrate pancreas is CT scan. So kung mag-ultrasound ta, ma-demonstrate nato atong liver, kaya naraman siya dapit na dool sa atong skin. And then the kidneys, na dool na po siya dari sa likod. And then also the spleen can also be demonstrated, but then the pancreas is naman siya sa center, and it's a fairly small organ. And then if ever mag-ultrasound ta kang patient, the sound waves cannot pass through towards this area na maglison nagpass through atong sound waves towards the central portion of the body. So that's why ang ginagamit na lang is CT scan. Okay, so that in order for the modality or the CT scan equipment to demonstrate the pancreas in different slices, and then it can also provide a 3D image, na, if possible, 3D image of the anatomy. Okay, so this is your pancreas na siya, nakat na with a pseudocyst nga formation. Pseudocyst. So pseudocyst is a fluid collection caused by pancreatitis. So in CT scan imaging, as you can observe, this is the pancreas. This similar lang gihapon sa atong other modalities. No, we are trying to deal with the colors nila. Unsay color sa isa ka part sa imong organ, it should be the same throughout. Okay? Kung gray na siya dadapit nga portion, dapat same ang ilahang grayness throughout. Na kung white ni siya dadapit nga portion, dapat napo na siya a certain value nga same ra na sila og kuan. Or almost the same sila og mga numbers. Okay, so in CT scan, if the cursor, like for example this one, kana siya ang cursor niya, the cursor of the CT scan, ang iyang tip ana, if ever ato na siyang i-move across the screen of the CT scan image, there are values that will be displayed across the screen. And these values would relate to the values of the soft tissue structures. Okay, so lahi ang value ni bone, lahi ang value ni air, lahi ang value ni liver, lahi ang value ni spleen. Okay, so if ever there will be problems with those organs, so for example, the pancreas, na nasa certain value niya, so if ever motaas ang yang number or moubos ang yang number compared to the normal range of CT numbers, and that will indicate that there is a problem with that organ, with that area. Okay, so for example, kanino kana siya, naatay gray levels dere. So some organs will appear naturally as ingana ilang color na white, like for example the bony structures, mostly nagi na sila the repeat ka portion, and then the air nato nga mga air containing nato nga mga organs is naa dere ilang color na towards the darker side of the grayscale. Okay, so nana sila mga nana sila indicated nga mga numbers. Okay, so if ever we try to move the cursor across the screen, across the image, if ever nakita dito sa CT scan nga modality, there will be numbers that will be displayed. Okay, and then those numbers will be used by the radiologist in order for them to diagnose properly the condition of the patient. Some of the numbers, for example, imuhang number, the natural number niya, buta nato gamiton nato ni siya 394 na siya. Buta nato 394 ang number dapat sa imuhang, buta nato 390 padulong sa 400 mo na ang normal range sa iyahang organ or the grayness level of the organ. If ever mo lampas na siya 400, mabot na siya 450, or kung dili mo below na iyang number, mabot na siya 370, then that means there's a problem with that organ, or nag-change ang iyang grayness level, nag-change ang iyang color dito sa CT scan image. Okay, so next we have the hepatocellular adenoma. Adenoma, this is related to benign nga mga formation. Okay, so hepatocellular adenoma is a benign tumor of the liver. So again, no, mga adenomas, these are commonly related to benign, while the carcinoma are related to having malignant nga mga diseases, malignant formations. Okay, so occurs most often in women using oral contraceptives, which play a role in the development of this benign lesion. So muna pinaka-common nga conditions why hepatocellular adenoma is being observed in patients. Okay, so this is just an example siya. So that is hepatocellular adenoma. So if ever natin mga cancer cells, these cancer cells will consume a lot of blood. no, will consume a lot of nutrients. So if ever mag-inject og contrast material to the patient, this contrast material will appear as white. No, like for example in this image, puti kaayo ang iyang aorta. So that means that the patient was being injected. No, this is the IVC para, sorry. This is the aorta. Siya. So that means that the patient was being inserted or being injected by contrast material na naay contrast material sa sulod sa lawas atong patient. Specifically sa iyahang kuan, sa ilahang blood vessels. Okay, and then the contrast material appears as white on the radiograph and then of course in the CT scan image. Okay, so if the cancer consumes a lot of blood and if that blood contains contrast material, then that cancer will appear as white. Now, the new formation siya mo appear na siya as white also on the radiograph. Okay, so if ever na mga masses, especially if na sila daghan or medyo taas ang ilang density, ilang subject density, then they will appear as white on the radiograph. Na mga, basically, these are masses. Okay, so this is your liver na siya in slice. Naka-slice siya, transverse nga slice or transverse nga section. And then, there's a part of your liver nga na ay new formation. Siya. So, that is hepatocellular adenoma. Okay, so, the CT scan alone cannot demonstrate or cannot evaluate what type of component is included sa ato ang cancer cells. So, right after CT scan, pwede dayon ta mag-biopsy din or the physicians nila pwede sila mag-conduct of biopsy of this cancer cell no, or of this new formation so that ma-evaluate nila if unsa gyud sulod ani nga cancer cell or the tumor no unsay component niya so they can evaluate it and then through histological nga examination they will be able to differentiate benign versus malignant and then what type of formation is growing inside of the patient. Okay, so next we have hemangioma, the most common tumor of the liver. It is a benign neoplasm composed of newly formed blood vessels, and these neoplasms may form in other places within the body. Okay, so that means yahang composition ani is mostly blood vessels. So again, when we try to introduce contrast material to the patient, so daghan po na siya contrast material nga kwaon si hemangioma kay daghan man siya blood vessels, so daghan po na siya contrast material nga makonsume. So these lesions generally do not become malignant. However, sonography may be used to assess the lesion if it is suspected that it has changed in size or in character. Now, along of course with the biopsy. Okay, so it may also manifest symptoms such as right upper quadrant pain as a result of tissue displacement or bleeding. Okay, so this is your hemangioma, kana siya. Okay, so this is an MRI image. An eggshell MRI image sliced through the liver reveals hemangioma. Siya. Puno kayo sa mga contrast material. Okay. So MRI can demonstrate or can differentiate different soft tissue structures. Okay. Because of its different parameters, it can demonstrate tissues with high fatty contents, with high liquid contents, what type of tumor are they, what are the components, MRI is best for that. Okay, so for the sizes of the tumors, we can use CT scan, but then for the demonstration of the tumor itself, its composition, its characteristic, its properties of the soft tissue without the use of biopsy, then we can use MRI. Okay, so next we have the hepatocellular carcinoma, or also known as hepatoma. It is a primary lesion of the liver. It has association between cirrhosis and hepatocellular carcinoma. No, if ever naakay cirrhosis or naakay liver cirrhosis, later on na nakatong na-mention na to ganina, no, liver cirrhosis, and then later on one of the causes po one of the effects po sa dynia is a development of hepatocellular carcinoma. Okay? And then if ever again naa kay liver cirrhosis, no naa kay labaw nagkuan kay mga alcohol abusers, no most of them may experience hepatitis B or hepatitis C because of alcoholism, and because of this sa katong alcoholism na ay infection of the liver parenchyma that would sometimes lead to liver cirrhosis. Siya mag-harden ang soft tissues ni liver, and then later on dayon some of the soft tissue structures may mutate, which will lead to the formation of malignancies. Siya malignant ng mga diseases. Okay, so this is an example of an image, and this is the liver of the patient. Na siya nadako na kayang liver, and then these are the new growths niya. These are the hepatoma. Kani sila na ana na, no, multiple na ang mga growth. Okay, so thus the incidence of this neoplasm is on the rise because of the increase in chronic hepatitis B and C infections. So based on US nga mga studies. So nagihapon diri sa Philippines. So, same lang gihapon ta mga causes. Most commonly because of alcoholism. Okay. Because the alcoholic yung mga substances being detoxified by the liver, so magsigig function imong liver later on na imong mga cellular bodies of the liver luyahan na sila, and then of course murag tani kanang kapuyo na sila, and then later on na ma-reduce nag-ayo ilang function, and then of course the worst is mag-stop na sila og function. Okay, so next we have the metastatic liver disease. The metastatic, this is related to having cancers, na malignant nga mga diseases within our body. So if ever naatay malignancies all throughout our body or any site of our body, one of the possibility is that these cancer cells, this carcinoma can spread towards the liver. Okay, so it is more common than primary carcinoma because of the liver's role in filtering blood. So diba, one of the pathways in which the cancer cells can spread throughout the body is through the through the circulatory system towards the blood vessels of our body. So mato sila sa blood vessels, and then they will just go along with the flow of blood, and then one of the pathways of the blood, or some of the organs, one of the organs that filters blood is our liver. So if ever i-filter ni liver si blood, and then that blood has cancer cells, then of course cancer cells so pwede sila magstay dito sa ato ang liver. So the liver is a common site for metastasis from other primary sites such as the colon, the pancreas, the stomach, the lungs, and then the breast. Kaya diba, from the circulatory system gikan sa artery mo flow ang blood towards the organ, and then from that organ butang nato from the colon ilang i-deliver ilang blood towards the venous system, towards the veins, and then if ever that venous structure iyang madala ang mga cancer cells, then the venous structure diba, it will be drained padulong dito sa ato ang liver, and then the liver will filter the blood, and pwede din siya mag-house og mga cancer cells. So that's why dali ra siya matakdan sa mga cancer cells if ever they are metastatic. Okay, so primary cancers located in the abdomen, especially those drained by the portal venous system, often metastasize towards the liver. Okay, sorry. So for example, this is our liver na siya, and then naanay mga metastatic activity na naanay changes sa color niya. Okay, so when you try to look at the images nato sa different modalities, you try to compare a normal image and then those image that has pathology conditions. Na if ever normal atong patient, ang color siyang liver is almost equal, tanan, no? Equal ang iyang color. If ever na problem si patient, then of course, like for example in this one, no, nag-change yung color. They appear darker compared to the compared to the natural na to nga liver nga color, di ba? Mas darker siya compared to the other side. And then sometimes if ever na po yung mga masses, they can also appear as much brighter compared to the liver nga parenchyma. Okay, so sonography is most important. It's most commonly used to screen patients for metastatic liver disease. No, for screening, i-screen na to si patient or ipa-ultrasound na to si patient para makita kung na ba problem sa iyang liver. Pero kung ato yung tanawon, what is the problem, what is the extent of the metastatic activity, then we need CT and MRI. Okay, so para makita yun na to nga si cancer cell is nag-spread na diri nga part sa liver ni patient, diri nga part sa liver ni patient na, and then their extent dayon kay basig na anay uh, especially the sizes, and then the extent of invasion na kung asa na sila ni paingon kay basin unyag naapay liver si patient, but then most of the liver ni patient is actually cancer na nga kuan na mga cancer formations. Okay, so that's why we need CT and MRI. Okay, kung mag-ultrasound ta, again, ito na-mention ako ganina, same ra na sila og images, mga slices, except kan CT scan and then the MRI, no mas wider ang ilang scope. Okay, ma-demonstrate yun nila ang whole of the patient's body. Okay, and then kung mag-ultrasound ta, kanira itong kakita, no, slice lang siya, ingana lang siya kanipis. No, dari lang dapit nga area ito makita na. So, depende kung asa ibutang ang probe. While CT scan, no, in a single slice, so makita na nato. And then it's not just transverse nga slices. No, we can also have, no, we can reconstruct the image nga naatay sagittal slice of the organ. Then naapod tay coronal nga slices of the different organs of the body in CT scan and MRI imaging. Okay, so that is the end for the hepatobiliary system na pathologic conditions. For the references, you can access the virtual library of our college. Naa dito si Radiographic Pathology for Technologies by Ninya Kowalczyk.